Hi, my name is Jason Salemi. I'm an associate professor of epidemiology at the University of South Florida College of Public Health. And today I want to tackle an issue that was recently brought to my attention that's utilizing the CDC COVID Tracker information that everybody's going to every day, and just some massive discrepancies if you're trying to dig a little bit deeper in the data. And in all honesty, things that on the tracker's website you should have already been warned about. So without further ado, let's dive in and explain what I'm talking about. So for people who have been navigating the CDC's COVID data tracker, which has some outstanding information on it, something that might commonly be done is to go on the left-hand side, look at temporal trends in cases, in deaths, in positivity for your state of interest. And so what I've got selected here is Florida. We're looking at your traditional epidemic curve with a 7-day moving average. So again, nothing earth-shattering about this, very commonly used to investigate information on all states, and you can even go down below the visualization, expand a data set, and download the data that allows you to now track daily information on cases. And again, you could get the same information on deaths and for other COVID-19 metrics. Now, at the bottom of this, in the footnote section, you can see that they're allowing you, the CDC is allowing you to view and download information from a data set that is called the Case Surveillance Public Use Data Set. And so just briefly, when you click on that link, it takes you to this page. And one of the things that you notice on this public use page is that there is also a 32 data element restricted access data set. And so just follow me here for a second. Here's the link to that data set, and the take-home message is you can go through a lot of different steps to try and get access to these data. I have done that, and therefore I have been given access to this GitHub site where I can download this case line data set that's got one record for every single person who has tested positive from all states. Well, at least the ones that have been reported to CDC. And so that seems like a really valuable file where it has indicators on whether or not the person was hospitalized, whether or not the person died from COVID-19, as well as a host of other data elements, including symptoms that they experienced. And so again, just a very rich data set. So now let's talk about the problem that I found. And this can be summarized by saying that there are different data sources used to report on seemingly information that is the same. This is all on CDC's COVID tracker. And to me, a gross lack of attention to warning the user, you, about these differences in, again, what seemingly should be pointing to the same thing. So enough nebulousness, let's dive in. So this is just a simple epidemic curve from that same site that I was talking to you about on the CDC's COVID tracker, where you could just look at cases over time. So you can also now, what if I wanted to know, well, how does this vary by gender? How does this vary by age? How does this vary by race, ethnicity? And so you might go to a different section of the COVID tracker, right below where we just were, under demographic trends. And so if you click on this first link and then select California, you basically now get females and males overlapped on top of one another. And obviously there's not a huge difference in incident cases per capita, at least in California, in these two groups, but you can see that the shape of the curve that you would have pulled in our first instance is the same thing that you would have pulled here. So the data look very, very comparable. And again, why might you want to do this? Well, I might want to look at by age, who's most likely to get infected? Where are we seeing our highest infection rates per capita? Or what about infection rates across racial ethnic groups? In this case, you can see a big disparity that Hispanics seem to have a much higher incidence per capita than other race ethnic groups. So really valuable ability to drill down if the state isn't providing this kind of data. But now, let's say I wanted to do the exact same thing in Texas. And so you initially go to just the epidemic curve in the first portion of the CDC's COVID tracker, and this is what the epidemic curve looks like in Texas. But what happens when you go to look at the information stratified by sex? Look at the bottom here. Look at the differences in the shapes of these two curves. And look at the fact that in Texas, it seems like they've been able to just get rid of COVID-19 since April 2021, right? There's obviously a big disconnect, even though all I'm doing is asking for the epidemic curve, the cases over time, to be stratified by gender. Big disconnect. And what if I go to Louisiana? Again, this is what I would get in, and what you would probably find on any Louisiana dashboard or the New York Times, anybody who's reporting information on Louisiana. The epidemic curve looks like what we see here up at the top. And again, this top graph is generated by the CDC COVID Tracker. But if we wanted this information now by sex, look, you see a few cases prior to July of 2020, and then it's completely flat. There's nothing that's been reported after that. So again, all I've asked is for the information to be stratified by a few variables, yet I'm getting an enormous disconnect between what I'm seeing in the two areas of the COVID tracker. And so, here's again, just to show you that it's not just, oh, maybe they didn't report sex, right? It actually says down here in the footnote, 98.1% of all cases have sex reported. If I'm looking at the breakdown by age, again, you get some numbers early on and then you get nothing. If you look by race, ethnicity, numbers early on and then you get nothing. And nothing in the denominator of this really is telling you why this is happening. And again, just to show you, like if we go back to Texas and that big, difference between what we're seeing, if you read the footnote to this top right graph, it says the most recent line level case record was reported during the week of July 10th. So even though we see hardly anything at all reported for Texas since April 2021, you get the impression that we've at least got some information as current as of July. And you can even see in this case, the percentage of cases reporting age by date, 98%. If we would have looked sex, it would have been 98, 99%. So you do get a potential 2-week delay in case reporting, but you don't get any meaningful information in the footnote that really tells you, hey, caution when you interpret this graph on the right or the same graph by age, that it does not seem to reflect actuality, or there does not seem to be a whole lot of agreement with the figure on the left, even though both of these come from the CDC data tracker. The one on the left seems to be aggregate reporting from the states. The one on the right is this CDC case line restricted data set that I've been talking to you about. And so again, in some of these cases, this is now Florida. So Florida on the top left, I'm very familiar with this epidemic curve and the summer surge of 2020, the winter surge, and then the current Delta surge. But if you look at that information and try and stratify by sex on the right, again, you just get a very differently shaped curve, a different idea of what the pandemic, how it's progressed over time. And again, if you look at the footnote, it says the most current information was reported very recently, right? August 28th, very complete reporting by sex. So you get the impression that this should be pretty complete information, yet we get this big disconnect. So now the analysis that I undertook to dig a little bit under the hood, I compared, so the most current CDC restricted case file was made available on August 17th. I downloaded that file, and that's what I used for that portion of the analysis. And then I took the aggregate information that's been reported as of yesterday. So this is when the states report to CDC and they upload their numbers of cases every day. And what I've decided to compare, because again, the CDC warns you that the most recent couple of weeks could be underreported, I'm just going to compare cases from the beginning of the pandemic through the end of July. And one important thing that you're going to find when I start going through all of the states here is there is a difference in the dates that are used. Like when we talk about the x-axis and we talk about cases over time, well, what is the date that is used? Well, in the CDC restricted case line file, they say we're going to use the earlier of the following two dates. So the first date is the clinical date, when somebody first developed symptoms or when the specimen that they tested positive on was collected, the earlier of that date or the date that they received this case line record for individual to the CDC. Obviously, the other data that I'm going to be comparing it to is basically just when the state reported the aggregate information to CDC. So a little bit of a difference, but it shouldn't make a pronounced difference. And so let's go now. I'm going to show you very quickly all of the states, right? You can see at the top right here, what I'm basically going to do in these slides is I've clicked on all of these states and I've taken a screenshot and I'm going to share with you just the massive variation, because for some of these states, the story that you're going to get from, if you're breaking down by gender or age, it's going to be almost identical to what you get by just looking at the basic epidemic curve. And as you'll find, for some states, it's almost like, why even pay attention to the breakdown by gender or the information that's coming from this restricted case file, because I think the data quality are just so poor. And so the order that I am presenting these states in is basically, you can see at the top left here, for each of the states as I click through this, what I'm doing is I'm comparing the total number of cases reported through July 31st on the COVID tracker, the one where the states are reporting daily aggregate information to the CDC, and I'm comparing that to this CDC restricted case line file, again, both of those through July 31st. And if I compare those two numbers, I'm now going to calculate the absolute difference in the number of cases and then the percent difference. And I am sorting these states from the least percent difference to the most. Okay? And so again, you're going to find some of those anomalies that I talked about. For all of these graphs, the black line is going to be what we see on the tracker when the states are reporting into the CDC every day. This is what people are most familiar with, that black line. The red line is what I've generated based on the CDC restricted case line file. And so again, as we start comparing some of these, you'll see situations like this, where maybe you'll see a big peak in the CDC restricted file. This could be, I cannot verify this, but this could be, you can see how there's a little bit of a disconnect between, well, actually a pretty big disconnect between this wave down here. The black line is much higher than the red line, but maybe we then get a big bulk in reporting to the CDC. Here's a bunch of individuals at one time, and maybe that's where we're seeing all of this fill in. So even though there's obviously a different shape in the curve, you do get an overall huge amount of agreement for the District of Columbia. And so again, that's the way I'm going to progress through these, and I'm going to try and move pretty quickly. So first, I'm going to talk about the states with less than or equal to 1% difference, again, in the cumulative number of cases reported through July 31st in these two data sources. And now for a lot of these, you're going to see that the curves look very, very similar. So here's Maine, Montana, Pennsylvania, Ohio. Again, you see some anomalous reporting, but they're capturing all of the cases at approximately the right time. California, Virginia, North Carolina, Maryland, Indiana, Tennessee, Minnesota, Idaho, Alaska, Vermont, Kansas, Massachusetts. So for all of these states, right, that I just went through, if you're trying to drill down on the CDC's COVID tracker and look at gender-specific information, race, ethnicity, age, which is all, again, meaningful information, I think you can kind of trust what you're seeing in the fact that it looks like all of the cases are being captured, at least during this time window. And again, you can just maybe trust a lot of the information that you're seeing. What about now states with a little bit more of a difference, but still not a massive amount? This is 1 through 5% difference. Oklahoma, again, you can see these curves are almost sitting right on top of one another. Arizona, Utah, Washington State, Iowa. And again, you can see the differences here, right? We're way below the peak. On the CDC restricted case file, the red is well below the black here, but it's well above the black here. And again, this could be differences in the dates that are being used. If we're basing it off of date that the person tested positive or date that illness onset began, that could be very different than the date that the information was reported to CDC. New Mexico, Illinois, you can even see just a little bit of a time shift here. South Carolina, New Jersey, Oregon, Delaware, Alabama, Connecticut. And again, you see some of these reporting anomalies probably trying to fill in some of these from this wave. Colorado, Nevada. Okay, Now states with a 5 to 10% difference. Rhode Island, and again, you can almost see a lot of backfilling here, trying to fill in maybe some of the missed cases early on. South Dakota, that's it. Now we're getting into larger differences, 10 to 20% difference. Now we're starting to wonder, why does the case line file have such fewer cases than have been reported? And so Wisconsin, Nebraska, Hawaii, we're starting to get into a 15% difference. New Hampshire, Georgia. And again, what I'm talking about here is you can see the CDC's tracker, what the state is reporting daily, is almost 1.2 million cases. The restricted file has less than 1 million. That's a difference of 230,000, or almost a 20% difference in the total number of cases reported in these two data sources. But the shape of the curves look pretty similar. Now we're getting into really big differences, 20 to 50% difference. Arkansas, Florida, Kentucky, Michigan. And I put this into a category of states that seem to have just stopped trying. It's almost like they've really stopped submitting data to the CDC. I don't know why, but look at these. North Dakota. You can see up until a certain point it was kind of lower, but mirroring the curve here. Then it just fell off a cliff, and it looks like we've got immensely scant reporting. They have 78% lower number of total cases that have been reported, by the state to the CDC on their aggregate data. Mississippi, similar story, right? We just get to a point where nothing else is happening, 85% difference. Missouri, looks like we got a little bit of a data dump here and then absolutely nothing since. West Virginia, 94% difference. Louisiana, 96% difference. We're not getting any information from Louisiana on the case line file. Texas, right? Huge state. Texas has reported over 3 million cases. Only 81,000 are captured in this case line file reported to the CDC. And Wyoming. Wyoming's missing 98% of cases. They've only got 1,300 in there out of 65,000 total cases. So again, my point in all of this, it's not to call anybody really out, but it's proceed with caution. Again, I think you should have already been warned when you're trying to move from looking at the overall epidemic curve and you click on that section of the CDC's COVID Tracker and you're trying to look at the information by gender, by race, ethnicity, at least for some of these states that are just obviously have, really poor completeness of reporting to the CDC. I don't know the reasons. There might be very good reasons, but when you're interacting with this tracker and you're trying to get information for your state, if you're in one of those states where they almost stopped reporting, you're going to get a very misleading breakdown by these important demographic characteristics. So this is more a cautionary tale than anything else. If your state tends to have a good shape of the curve, even if maybe they're 5% underreporting, you can still look at the relative differences between genders and race ethnicities and maybe still get a good picture. But obviously, for some states, I just wouldn't trust what I'm seeing when I'm starting to break down by some of these demographic characteristics, because you only have a fraction of all cases. And I'd really like to give a big shout out to Dr. Beth Pathak. She's one of my colleagues. We work on the COVID project together. By the way, if you want to know, pretty much anything on kids, we're trying to compile as much information from all of the states on cases, hospitalization data, you name it. I'm proud to collaborate with this very small but mighty team, and I just want to give her a shout out. She was the one that really brought this to my attention, focusing on the Texas data. She was trying to compile some information on kids from the CDC restricted case data set. Nothing made sense, and we started to really dig a little bit deeper into all of the state level variation and all of this. So I just wanted to thank her for bringing it to my attention. I wish it didn't take me so long to put a video together, but as always, if you have any questions, I tried to keep this as brief as possible, but still explain the situation. I know a number of people have also said to me, for my state, I've tried to drill down to information. Things just didn't make sense. Hopefully this helps to maybe not explain why we see some underreporting in states, but at least identifies the issue and gives you at least some caution as you move forward to try and understand your data. So I hope everybody's doing well, and I'll talk to you soon.